Today I'm going to talk about pain, tooth infections, root canals. We all get it sooner or later. It's going to happen. It's inevitable. But when you get it, I mean, it's pretty much a given. Nothing personal with the dentists or the dental practitioners necessarily, but I hate going to the dentist, and I'm sure many of you do too as well. If you can treat this problem by yourself, all the better. Now, here's how it's done. With Korean hand therapy, the whole body's on the hand. It's like, well, let's see, I'll go through this again. It's like an animal walking along like this, and he's looking around, he has a drink, looking around, and off he goes. But anyway, so this is the front of the body, and this is the back of the body. The spine goes all the way down, back of the head, back of the neck, 7 vertebrae right there. All the way down, thoracic, and down into the lumbar area to the tailbone, to the tip of the bone right there. If you've got a tailbone problem, not an uncommon problem, simply probe around, locate tender spots, cover them with aluminum or silver, and bingo, the pain is gone, and it will rapidly heal those injured tissues. But we're talking about tooth pain here. And so here's your head. I got a little picture. It's a little sloppy, but it'll do. Now, if I have a problem here, right here, this one, lower jaw and so on, the nose is in the middle, from the top of the head to the crease there. Halfway in between is your nose, halfway between there and the crease, you've got your mouth. If you've got a tooth problem there, you're going to have a tender spot right in there. Just probe around, locate that tender spot, pull out a pen and just mark it. Once that's marked, come back with your silver ink or even aluminum. Aluminum works fine. Just take a little piece of aluminum and secure it to that spot there with Scotch tape or any kind of tape. And the pain will go away within 30 seconds to a minute. The pain should be relieved. But in this case, I like to use silver because I know that silver historically has been known to be antibacterial, antiviral, and antifungal. So when I put a little dab of silver electrodes right there on my tooth, right there, there's my tooth. You thought it was here. Anyway, right there, of course, I get silver ions coming down the arm and right up to my mouth, right up to the tooth pain, right there. And sometimes the pain is, will go away completely. Often that's the case, but often it might take a day or two before that. Well, usually a night, and the silver ions will come in and address the pain and also address the infection. We're electrical creatures. Our whole body is electrical, and so that electrical current, which is coming down here and going to that tooth, is going to balance the electrolytes and balance the pH. It's going to stimulate the mitochondria, which will generate ATP, energy, healing energy production. And that tooth pain will be effectively addressed by the next morning. You should not have the tooth pain there. Now that's a great therapy. And once that is dry, it takes about 3 or 4 minutes. You take your handy-dandy silicone here and just apply it with these special doe foot applicators, and there you go. You just add it to the dried electrode there, and bingo. That should stay on for at least a couple of days. The silicone adhesive is the absolute best for securing electrodes. Westmore silicone solutions or adhesive. Now the other one, if you look here, actually, just have a look right there. I'm treating a tooth problem, which will be on this side of the face, and you use your little probe there with a little rounded end, and just feel around until you find that sore spot there. Mark that with a pen. Come back, cover it with a silver electrode, pure silver, water-based electrode, and bingo, that pain is going to be reducing within a minute. And within a short period of time, the infection will be addressed as well. And then you cover that. You can cover that with the silicone base too, and that will stay on for several days and effectively, thoroughly cleanse and clear any infection and so on from that tooth. So again, that's a wrap. If you ever have a tooth problem, just remember this technique and send me a thought. Anyway, thanks very much, and I just saved you a little money from going to the dentist. Thank you. Bye now.